All right, we are taking your questions now for Dr. Zorba Paster.
If you have a question, the number to call is 608-270-9933.
All right, we are ready, Zorba. Let's start with Diane in Montello. Hi, Diane.
Hi.
Go ahead.
Yes, I have a problem with my left ear. I can't hear anything out of it. I woke up one morning and my hearing on the left side was totally gone. I've been to the audiologist 2 times. I've been to an ENT. I've had an MRI, and nothing. They don't know.
Well, there are a few things. First of all, when you get an MRI scan, there's a false positive and a false negative. So, indeed, you might have had a stroke to that area, to the nerve, and it just doesn't show up on the MRI scan. MRI scans, no scan is 100% perfect. But you've had all of the tests, all of the things done. There are a number of diseases that can actually cause that. Meniere's disease and other things can actually cause a sudden hearing loss. And the answer is sometimes we don't have an answer, but it's important to make sure you protect that other ear, because now you have got hearing in one ear, and that means making sure if you need a hearing aid to do it, and don't put loud music into that ear.
Could it even be something just like a wax buildup or something?
Well, in her case, she went too much of...
You had that checked.
Right, that's exactly it. And that would be the first thing you would check.
Okay.
All right, well, good luck.
Yeah, hang in there, and thank you for calling.
Let's go to Ann in Oregon. Hi, Ann. What's your question?
Hi there. I just recently had a loved one diagnosed with PKD, and I just was wondering Dr. Zorba's thoughts on, can we really slow it down with water and low sodium diet?
So what actually is going on with them, with their kidneys?
They have cysts, like 70% of cysts.
Right,
yeah.
right. So the answer ultimately, if you have any kidney disease, get a good consultation with a nephrologist. That's important. There's a diet that you basically follow. Diet has to really do with the amount of sodium you're taking in and the amount of potassium, making sure your blood pressure, your cholesterol is under control, and then eating a more Mediterranean diet and exercising. All the things we do really for cardiovascular health also help with any kind of kidney disease.
What is PKD in acronym?
Polycystic, I think she's talking about polycystic kidney disease. And quite often there's nothing you can do if it's both kidneys, and sometimes you need a kidney transplant.
Well, so got to watch the numbers.
Absolutely, got to look at the numbers and have a good relationship with the nephrologist.
Okay. All right. How are you doing with the flu?
Well, not good if you have it. But the reality is just beginning to start, but we're really worried this flu season is going to be one of the worst flu seasons, because for the last 2 years, of course, we have worn masks to make sure we don't get COVID, and the answer is we haven't gotten flu during this time period. So if you've not gotten your flu shot, get it, and if you've not gotten your COVID shot, get that one too. And basically, I recommend you get them both at the same time, because they will actually improve the immunization in your body for both.
And if you want to get vaccinated before Thanksgiving, the COVID booster, you need to do it pretty soon, though.
You've got it.
Right.
It's not going to kick in by then, though.
No, it takes 2 weeks.
Yeah.
Takes a couple
All right, let's go to Charles in Richland Center. Hi, Charles.
Hey, good afternoon. And I got a question about, I just got the 5th shot, and about 3 weeks ago, and it seems to have settled in my joint of my shoulder. Is that kind of normal, or...
Not particularly. If it's settled in, quite often after you get the shot, you're going to get pain in your shoulder. That is a really totally common thing. But if you still have pain in your shoulder, it's not getting better after 2 or 3 weeks, I'd recommend you get it checked out. It may be something else, maybe arthritis or something completely different. I don't think the COVID shot is going to cause pain in the shoulder 3 weeks, 2 or 3 weeks later.
So let's back up to... Okay,
Thank you for calling.
Let's see, I think we have a call here.
Yeah, we do.
But I don't see the name, so there we go. Let's go to Dana in Evansville. Hi, Dana. What's your question? Dana, you there?
Hi. Yes, I am. I was wondering, my mom died of pancreatic cancer when she was 54, and I just went through breast cancer treatment at 47. My brother was diagnosed with colon cancer at 44, and I'm wondering if there's any tests I should have done to make sure I'm not passing this on to my children.
Well, clearly, when you have those many people in your family, you wonder, is this coincidental, or really is there a gene that's involved which actually causes cancer? And right now, we're really at the crux of understanding that. There's a gene that causes melanoma, for instance, in families that also causes pancreatic cancer. But I think one of the things you can do is you can talk to your doctor about getting genetic counseling. And if you get genetic counseling, you can often then get a series of genetic tests, and you might find out that you have one of several genes that actually produce different types of cancers, such as pancreatic cancer.
it's-
And so sorry for your
Yeah,
loss.
tough break,
Dana,
Dana.
be
so-
well.
All right. We're out of time. Zorba, we'll
Happy
do this again.
Thanksgiving, although it's not quite
We
Thanksgiving.
won't see you next week unless you want to come out here by
No,
yourself.
I'm in
We won't-
Turkey.
We won't
I'm
be
in
here.
Turkey.
All right. Happy Thanksgiving.
You too.
Good to see you.